Over the years of clinical practice and medical education, doctors and med students have already read hundreds of books, but here we are sharing 8 interesting non-medical books for you to read. Number 1. The Idiot Brain. Haven't we always wondered how our brain works? Why we feel or act in a specific way? How to control our brain. The Idiot Brain is a book by Dean Burnett categorized into small, interesting topics to challenge your thinking and answer your endless questions about how the brain works. Number 2, the mindset. The stressful competitive field of medicine always draws us into a loop of questioning our own capabilities and whether we can make it or not. In this book by psychologist Carol S.Dweck, she introduces a groundbreaking idea of how our behavior and accomplishments are directly influenced by our ideas and perception of ourselves, and also how we can change a rooted misconception into a growth-directed one. Number 3, How to Win Friends and Influence People. An all-time masterpiece. A doctor or not, you have to read this book by Dale Carnegie. We humans are social animals. It is important to us to belong to a group and have friends. This book helps you reach your potential in making new friends and guarantee you a long-term relationship. For doctors, building a rapport and having connections with your patients is essential to your work, so this book will definitely help you with that. Number 4, Thinking Fast and Slow. In this book, Daniel Kahneman explains simply the 2 systems that control how we think: the fast, intuitive, and emotional system, and the more logical system. The author explains our actions based on the system we use in thinking. He exposes the flaws and biases in the fast way of thinking depending on our intuition and how we replace these with the slower, more rational way of thinking. In the medical practice, knowing the differences between both ways of thinking would help you to make right decisions based on facts rather than just feelings. Number 5, The Gift of Imperfection. An inspiring book by Brené Brown to help us in embracing our own imperfections and believing that we are enough. Research suggests that doctors, especially international medical graduates, have their own insecurities. That is why reading such a book would help you cultivate the courage to wake up in the morning believing in yourself and allowing yourself a room for growth. Number 6, This Is Going to Hurt. Secret Diaries of a Junior Doctor by Adam Kay, the author who is an obstetrics and gynecology intern at NHS, and in detail writes about the years he spent working as a surgical intern. In a hilarious tone, the writer describes the most painful moments he had, the horror, the anticipation, and the happiness too. It is a sugar-coated, hard-to-swallow pill. If you are still a student, this book might give you an insight of what to expect. Number 7, Careers in Medicine. A thorough guide to help you choose your specialty by Terrence J. Sachs. Choosing a specialty in medicine is one of the most confusing and stressful decisions you need to make in your career. Having a guide to help you know yourself more and know what suits you the most is definitely needed. In this book, you will go through the pros and cons of every specialty in an unbiased way to help you reach your decision. Number 8, When Breath Becomes Air. At the age of 36, on the verge of completing a decade's worth of training as a neurosurgeon, Paul Kalanithi was diagnosed with stage 4 lung cancer. The life-changing fact of a person who spent his life treating dying patients into becoming one himself is really hard. Facing the questions of, is anything worth it? What's next? And what's going to happen now? The author died in March 2015 while working on this book, leaving a masterpiece for generations after him to learn from his experience. Thank you for watching. If you have suggestions, please add it in the comment section. If you like this video, please click like and subscribe.